Trigeminal neuralgia is a severe facial pain usually experienced in one side of the lower face. It is often caused by compression of the trigeminal nerve by blood vessels. Those affected by the condition often experience regular attacks, with some experiencing periods of remission that usually get shorter over time. One of the few treatments are anticonvulsant drugs. They work by blocking the excessive rapid firing of neurons. If they do not help, a temporary fix may be to damage the nerve to prevent it functioning. However, the most effective treatment is opening the skull and moving the offending blood vessels. However, this is a major operation and carries significant risks. The trigeminal nerve enters the skull in three places: the foramen rotundum, ovale and spinosum. Foramina are the small canals in the skull that allow blood vessels and nerves through the bones that encase the brain. However, foramina are not the only holes in the skull. There are also hollow bones called paranasal sinuses. Named after the four bones in which they are located, sinuses perform a variety of tasks. They lighten the weight of the head, support the immune system, humidify inspired air, increase the resonance of your voice, and in some cases act as a crumple zone to protect your brain. The sphenoidal sinuses located in the sphenoid bone, just behind the nasal cavity, can be used to access the pituitary gland. Unlike the ancient Egyptians, who removed the brain during mummification by poking through the ethmoid bone, endoscopic transsphenoidal surgery is performed on the living to treat pituitary adenomas. The slow-growing benign tumour is operated on using an endoscope, and other small surgical implements pass through the sinus. As well as one of the largest brain to body mass ratios, humans have some of the most complexly folded brains, comprising of primary, secondary and tertiary structures. Occurring in both the second and third trimester, cortical folding, or gyrification, allows a greater density of neurons, allowing higher cognitive abilities. However, the wrinkles are not everything. Cortex function is also an important factor in intelligence. No matter how smart you are, you can still get headaches. Even though headaches are a common illness, they are poorly understood. Scientists have categorized two types of headaches. Primary headaches are an illness, and secondary headaches are simply a symptom. Owing to the lack of pain receptors in the brain, headaches are experienced through the nerves in the blood vessels, muscles, and pain receptors in the skin. For example, infected sinuses heated due to the immune response increase their size, pressurizing muscles and blood vessels. This triggers nociceptors, releasing neuropeptides that inflame the compressed blood vessels. This pressure leads to the secondary headache. Thank you for watching my animation. I hope that you have learned a lot of new things and that you are inspired to pursue a degree in medicine.